Guess what happened immediately after health care bill was passed? The insurance company said, oh, we can't deny kids with pre-existing conditions anymore? Well, that's what you say. I say we can. What do you mean? It's in the bill, right? It says that if they have a pre-existing condition, you must accept them for getting insurance. Well, the insurance company lawyers say, quite literally, no. We read the bill, and it says that we have to keep them if they already have the insurance. But it doesn't say that we must accept them if they have a pre-existing condition and they didn't have insurance in the first place. That part gets fixed for everybody, including the adults, in 2014. So, sad day for you. And now Obama and the White House and the Democrats are outraged. But what are you outraged at? I mean, what do we tell you all along? If you leave the insurance industry in charge, they're going to nickel and dime you. They're going to try to find every way to deny you coverage because they make more money if they charge you more and they cover you less. It's simple math. So now I'm going to give you the quote because there's another twist in here. It's William Schiffbauer, he's a lawyer whose clients include employers and insurance companies, said, quote, the fine print differs from the larger political message. If a company sells insurance, it will have to cover pre-existing conditions for children covered by the policy. But it does not have to sell to somebody with a pre-existing condition. And the insurer could increase premiums to cover the additional cost. And that's point number 2. What did I tell you? I said they would immediately raise rates. And they would blame it on the bill. And that's exactly what this is point number 1. There's another news story out, which is point number 2, saying, well, obviously we've got to raise the rates because the health care bill that just passed, that's, and it's making us cover all these people. And the specific provision that they cited, of course, was a lie, not true at all. That provision doesn't kick in until 2014. But they say, oh, no, we have to. It's because of the Democrats and the bill that they passed. No, your premiums are going to go up. Now, what did I tell you about my concern about the bill? I mean, go ahead. You tell me what I told you. You can look at old clips. Okay, what I told you was they're going to raise your premiums and they're going to blame it on the Democrats. They're going to blame it on health care reform because you didn't fix the underlying problem. You got bandages on some of the problems, and some of them are good bandages. But the underlying problem is, as long as the insurance companies are in charge of our health care, they have a profit motive, a legal motive. They have to, by law, try to get as much money from you as possible and give out in coverage as little as possible. So, of course, they're going to try to get around the system. Now, the Democrats, being the so-called idiots they are, I don't know if they're playing along or if they really are this stupid, are all shocked. Senator Rockefeller says, the ink has not yet dried on health care reform bill, and already some deplorable health insurance companies are trying to duck away from covering children with pre-existing conditions. This is outrageous. Well, that's why I told you to give them a public option so we could go the other direction. And you said, no, we have to protect the insurance companies. Now you've all of a sudden find it outrageous. Now, I mean, look, what are you going to do with these guys? What are you going to do with them? They purposely don't fix the system, and then I don't know if they're real or they're pretending to be shocked and chagrined. Turns out the insurance companies want to make more money off you. Huh? It turns out they got lawyers, and they're going to try to get around every single rule we passed. Who could have seen that coming? Right here. I saw it coming. All right, now here's Waxman from the House side. He says the concept that insurance companies would even seek to deny children coverage exemplifies why we fought for this reform. Wrong. It exemplifies the reform you should have fought for, but you did not. Your reform tries to get them to cover children. It tries to get rid of pre-existing conditions and rescissions, etc., but it leaves them completely in charge still. And none of what the senators and the congressmen say addresses the cost issue. Even if they get the insurance companies, they pass a new law, or they win in court, because already instantly insurance companies are talking about, oh, we're going to court. Oh, we're not going to pay for this, right? We're not going to cover your kids with pre-existing conditions. If you got a kid that's sick, that's your problem, not my problem, man. You're getting in the way of my profit, right? But you didn't address the underlying problem, Waxman. You did a bandage. All right, I got one more for you. This is from the New York Times. The issues to be resolved. These are not, the children are not the only thing. Here's a new list of issues that the insurance companies have come up with. The issues to be resolved include defining the essential health benefits that must be offered by all insurers. Now, you said essential health benefits. You didn't say what was essential. Here come the lawyers to deny you more coverage. Next one. Deciding which dependents are entitled to stay on their parents' insurance. Remember how you were supposed to have your kids, they could stay until 25, 26 years old under your coverage? You're like, well, it depends. I'm going to have my lawyer go to court and fight it, so you don't get that benefit. Now, if we had a government-run option, whether it's a Medicare buy-in or a public option, could they do any of this stuff? Oh, no, they couldn't. They'd just have to offer you the insurance. Funny. I wish someone had fought for that. It continues. Deciding which dependents are entitled to stay on their parents' insurance, determining who qualifies for a hardship exemption from the requirement to have insurance. Not going to count the hardship exemption either. They're going to try to find a way around that. And deciding who is eligible for a new long-term care insurance program. I'm supposed to give you long-term care, but it depends. Are you eligible or are you not eligible? So here comes this great screwing over of the American people again. Why? Because as I told you, they didn't really fix the system.